Abhay Vasavda, at the outset, I would like to thank you for accommodating my request to speak from the sitting position. And I would like to thank Dr. Kullapalli Rao, the President of the AOI, to have agreed to accommodate us in the session and allowed to speak. I am going to talk to you on the results of our study done for the diabetic retinopathy, in which we did the conventional PRP and compared the two types of lasers, one single spot laser and the other multiple spot laser, Pascal. PRP, as you know, is the gold standard. PRP, as you know, is the gold standard treatment of PDR. Traditionally, single spot laser delivery system has been in use. Recently, Pascal system, which delivers 69 spots, patterned in any way for delivery at a time. Next, please. The oldest instrument which was used for PRP was a light coagulator made in Germany. These are the original pictures of the photocoagulation carried out with the light coagulation. Next, please. The usual methods which have been followed for doing the PRP, initially we were using the xenon light, then we started titrating the photocoagulation, first doing in one quadrant, second quadrant, third quadrant, and so carry out the coagulation in 2 years. The different types of pattern which can be created by the Pascal laser are shown here. Next one, please. And the comparison between the single spot laser coagulation PRP and the pattern type is also looking very contrasting. Next. These are the two machines which we have used in our study. There is less collateral damage, there is reduced fluence required, there is less time needed for doing the photocoagulation by the Pascal multi-patterned multi-spot laser. Fluence is energy used into duration upon spot size. And normal laser fluence, the single spot, is 127 joules per square centimeter. With Pascal, fluence can be reduced to 30 millijoules. This is the pattern of the study we carried out. Next, please. Next, please. We carried out, next, please, the photocoagulation done with the two systems. The criteria for inclusion in the study was a prospective randomized comparative study. 60 patients were included, 26 females, 34 males, age 45 to 61 years. Inclusion criteria: symmetrical PDR in both eyes, BCVA 660 or above, 6 months follow-up must for each patient included. Exclusion criteria was any prior surgery done or any laser done before, or if there is severe maculopathy, or if there are ocular disorders like glaucoma and uveitis. Next, please. We use the semi-automated 532 diode laser for delivering the spots in both the cases. You can see the live play of the laser pattern spot. Next one, please. The conventional slit lamp based delivery was with 532 nm green laser, same as in the other, single spot in one quadrant. One eye each of the selected randomly for GLX and the other eye was subjected to Pascal delivery. PRP completed in 2 sittings. Grade 2 to 3 burns were achieved. Next one, please. The laser parameters were 200 microns for the GLX and same 200 microns for the Pascal. Duration was 200 milliseconds and 20 milliseconds for Pascal. Power ranged from 200 to 400 in the GLX and 630 in Pascal. Fluence calculated was 127 to 255 and 25 to 64 in the Pascal. So you will see the advantages. This is the picture of one of the cases included before and after doing. This was the achievement of the checking of the proliferations as well as the absorption of the blood. The first conclusion which was drawn out of this study was the time consumed. Because 59 points could be given at a single stroke, the time consumed was 1.43 minutes in 1/2 PRP, whereas it was 4.53 minutes when you use single spot laser to cover the visual analog scale to test the discomfort or the comfort level. Next one, please. The range was, can we go back? Range was 3 to 9 GLX and Pascal was 0 to 1. Average was 4 to 6. So relatively it was more comfortable undergoing treatment of PRP with Pascal laser. Next one, please. Infrared images created showed a difference in the size of the Pascal laser and the single spot laser. Next one, please. Next one, please. Infrared laser spot images. Next one, please. This is with the Pascal and this is with the green laser single spot. After 7 days of the maturation of the reaction, you can see the difference between the size of infiltration, inflammation shown in favor of Pascal. The field of vision carried out in all the cases showed the results of better leftover field of vision in the Pascal system than the single spot, but it was not statistically significant. This is the result, and we had done an experimental study in rabbits. Next, please. The spots given in the upper part are the single spot lasers, and the lower part is the Pascal system, 59 points at a time. If we look into the pathological pictures, we stain it on the 15th day. 40 times magnification shows the Pascal system showing very little infiltration, spot size very small as compared to the single spot laser system. Next one. There was luckily a patient of melanoma who agreed to allow us to test the two things in the remaining area of uninvolved area of the fundus, and we did both the Pascal as well as the single spot laser in the same area, and we find, next please, histopathology showing the difference in the size of the Pascal and the single spot laser in favor of Pascal. Concluding the study, regression of proliferative retinopathy achieved by both Pascal and GLX very clinically similar Time needed to complete the PRP was remarkable, less with Pascal. The visual acuity scale, comfort scale was better with the Pascal system than with the single spot laser. Infrared images showed less spreading of the laser spot with Pascal system. Retinal sensitivity, the field of vision remained more with the Pascal systems. I would like to thank you very much.